Welcome to The Explainer. Today, we're tackling something you see all the time. A patient at your counter, handful of prescriptions, fresh from cataract surgery. Now, this is one of the most common procedures in the world, and your role as a pharmacist, it is absolutely vital to make sure that recovery goes smoothly. So here's our game plan. We'll start with your specific role. Then we'll get into the why behind all those different eye drops. We'll decode the actual meds you'll be dispensing, cover the really serious red flags to watch for, and then wrap it all up with the key counseling points you need to know. I mean, just think about it. You are literally the last stop, the final checkpoint before that patient goes home to start what can be a really confusing regimen. This is so much more than just slapping a label on a bottle, right? You're there to cut through the confusion and set them up for a smooth, easy recovery.
Okay, so that moment they're standing at your counter, it is so critical. Your top priorities are making sure they get the what, the why, and the how of their drops. You're doing that crucial safety check against their other meds and conditions. And maybe the biggest thing, you're empowering them to spot trouble. Seriously, what you do in those few minutes can literally save their sight.
All right, so to be a really great counselor here, you've got to understand the why behind this sometimes crazy-looking drop schedule. And you know what? It really boils down to four main goals.
So here's the bottom line. Every single one of those little bottles has a job that fits into one of these four buckets. First, we're tamping down the body's natural inflammatory response. Second, we're trying to head off a really nasty infection. Third, we're just keeping the patient comfortable. And fourth, all of this together just helps them get their vision back on track, fast.
Okay, let's get to the good stuff, the drugs themselves. So what are you going to see? Well, it's usually a trifecta: anti-inflammatories, antibacterials, and yeah, sometimes even glaucoma meds. First up, the anti-inflammatories. You're going to see both steroids and NSAIDs, and hey, sometimes you'll even see them prescribed together. Now, steroids are the heavy hitters, for sure, but the big flashing warning sign with them is that risk of jacking up the eye pressure. NSAIDs, they don't have that pressure risk. Plus, they do double diddy. They also help prevent something called cystoid macular edema, which is basically swelling in the back of the eye. Super important. So let's make this super practical. If you're dispensing something like prednisolone, two big things. Tell them they must taper it. Don't just stop. And let them know it can hide an infection. Got ketorolac? That's your cue to ask about aspirin or NSAID allergies. It's a quick check that can prevent a lot of trouble. And with Nepafenac, that Shake Well sticker isn't just a suggestion. It's absolutely critical for the drug to work right. All right, moving on to the antibacterials. Their one and only mission, really, is to prevent something called post-operative endophthalmitis. Now look, it's rare, thank goodness. But when it happens, it is devastating. We're talking potential vision loss. That's why we don't mess around. Surgeons go for the big guns, the broad-spectrum stuff, which is usually a fourth-gen fluoroquinolone. Moxifloxacin is one you'll probably see a ton of. A little pro tip, some brands are preservative-free, which can be a real bonus for patients with sensitive eyes. And hey, keep an eye out for those combo drops, like atobromycin/dexamethasone. They can be a lifesaver for adherence, because it's fewer bottles to juggle. But, and this is a big but, you've got to remember there's a steroid in there, which brings all the steroid counseling points right back into play. Okay, so for the antibacterial, here's what you really need to hammer home. First, this is a short course, like a week, maybe 10 days. Second, they need to start it immediately. Third, and this is the big one, if anything gets worse in that first week, it's an emergency. No waiting it out, period. And last, tell them to toss the bottle when they're done. This is not something to save in the medicine cabinet just in case. So that third category you might see, glaucoma meds. And this is where patients can get really confused, right? They're like, but I don't have glaucoma. You just need to explain that, hey, it's super common for eye pressure to spike a little bit right after surgery. These drops are just a temporary fix for a few days to keep that pressure down and keep the eye safe while it heals. And right here, this is a perfect illustration of why your review of their full med history is so important. You see a beta blocker eye drop like timolol. You have to be thinking about systemic effects. You got to ask about asthma, COPD, any breathing problems. Same thing with an alpha agonist like brimonidine. You need to be cautious if they have serious heart issues. It's the perfect reminder that an eye drop is never just an eye drop. Okay, let's shift gears to what is, honestly, maybe the most important thing you'll do. And that's teaching the patient how to spot trouble, how to know when they need to pick up the phone, urgently. And you have to be absolutely crystal clear about this. If a patient calls you or walks up to your counter and describes any of the stuff we're about to go over, the answer is not wait until your next appointment. The answer is you need to call your surgeon's office right now, or you need to go to the ER. No ambiguity.
So what are these big red flags? Well, obviously if they bumped their eye, that's a call. Their vision should only be getting better, so if it starts getting worse or blurrier, that is a huge warning sign. Pain should be improving too. If it's getting more intense, especially with a headache and nausea, that could be a massive pressure spike. And then there's a sudden increase in floaters, flashes of light, or a new shadow. That could mean a retinal problem. That is an emergency. And you can also empower them with things they can actually see themselves. Tell them to look in the mirror. Is it getting more red or more swollen? Bad sign. How about the cornea, the clear window on the front? If that starts to look hazy or cloudy, that's a call they need to make. And if they see a visible layer of white stuff in their eye, a hypopyon, that's a classic sign of a severe infection. Finally, if light suddenly becomes incredibly painful, time to call.
Okay, so we've covered the why, the what, and the when to worry. Let's put it all together. Let's create a quick action plan, a little checklist you can run through in your head every single time one of these patients comes to your counter.
So, here's your quick checklist. First, double check the eye and the schedule. Simple, but crucial. Next, go over the technique again. Emphasize waiting 5 minutes between different drops and then gently closing the eye for a good 30 to 60 seconds. Then a quick question. You have your follow-up appointment all set up, right? Remind them to keep taking their other regular meds. And finally, one last time, you gotta hammer home those red flags and make sure they know exactly who to call.
Look, if there is one single thing to take away from all this, it's this quote right here. This is the mindset you need to have, and it's the mindset you need to give to your patients. In that first week, if anything, vision, pain, redness gets worse, you have to assume it's the worst case scenario until a doctor proves it's not. It is always better to make the call.
You know, when you break it all down like this, it just goes to show how incredibly crucial the pharmacist is in this whole process. And it kind of leaves us with a big picture question to chew on. As medicine gets even more complex, what's next for us? How can we, as pharmacists, get even more involved in co-managing these cases to make sure our patients get the absolute best outcomes possible?